As we reported earlier, several states are now reconsidering or outright reversing the opening of bars and indoor dining at eateries as coronavirus rapidly spreads through parts of the country. And as you heard earlier, the governor of Arizona just announced the state will reduce indoor dining capacity to 50%. So what's the risk? Ariel Reshef has this report.
For restaurant and bar owner Steve Wegman, the COVID-19 crisis has dealt a major blow to business.
Here comes coronavirus knocking on the door, and you go from, $100,000 a week in sales to $5,000.
Steve's bar, the 507, was linked to an outbreak of cases in Mankato, Minnesota. One of his employees testing positive for the virus after it reopened, forcing him to shut down again. Since then, he says, it's been a struggle.
Basically, your world is collapsing. I mean, you're going to be marked. You're going to be, what are the ramifications? Are you going to be held to certain accountabilities and whatnot? So, I mean, you just don't know what's going on.
With mounting reports of clusters linked to local bars and restaurants in several parts of the country, and with images like these of packed public spaces, the nation's top infectious disease doctor now urging that shutting down bars could be key to stemming community spread as new nationwide cases surge to more than 50,000 per day.
Fundamental things like masking, distancing, washing hands, closing bars. If you do that, I think it'll be a giant step towards interfering with the spread in your community.
Some officials from coast to coast reversing course. To date, at least 21 states rolling back reopenings. Florida seeing record numbers, now exceeding 220,000 cases since the beginning of the pandemic. Miami shutting down indoor dining, bars, clubs, and other establishments.
We don't impose these rules for government's sake. We impose them to protect our residents and protect our visitors.
And in Texas, one of the first states to reopen, a surge in cases surpassing 200,000. Houston bartender Bevan Biggers says it's a personal and painful balance to work as COVID rages on.
I did not expect to be in this situation and watching people around me die. Yeah, because I've lost 2 family members to COVID already.
Bevan says she also lost her job after she spoke out about cases at the restaurant where she was employed.
I had symptoms. Other coworkers had symptoms, and I wouldn't be doing my job as the main bartender there because I can't keep doing this back and forth, risking my life, risking people around me. Because, when I go to work, I come back home and, I have people around me that I don't want to hurt either.
Biggers' employer reportedly denies firing her, stating she's been taken off the schedule for 2 weeks after experiencing symptoms of illness. The Texas governor now shutting down bars and limiting restaurants to 50% capacity as states and cities weigh the economic and public health costs and benefits of reopening certain industries. Businesses like Steve's are facing an uncertain future.
Every day we're being told that maybe we should do this, maybe we should do that, maybe we should do this. Now we have to do that. So, at the end of the day, you're going to get the answer, but we're just not there.
But after months of safer-at-home measures, Americans are hungrier than ever for a taste of normalcy. So what are the risks at restaurants and bars? And should they outweigh America's appetite for dining and drinking out?
I think that it's very important to realize that, we have to think of individual risk.
Dr. Todd Ellerin is a leading infectious disease specialist and vice chairman of the Department of Medicine at South Shore Hospital in Weymouth, Massachusetts.
Do you believe that states rushed to reopen bars and restaurants too soon?
In the United States, we have really a patchwork, so it's a very heterogeneous place. So I think, for instance, in my region in Massachusetts, clearly case percentage was down, hospitalizations down, so it made sense. In other states, there seems to have been probably a rush to too early of an opening.
If you're heading out to a restaurant, is there anything you should take with you?
I think obviously our mask is vital, and we should be wearing it as much as possible. Disinfectant, a hand gel, for example, with alcohol, 60% alcohol to clean our hands. I think that's reasonable to take to a restaurant. So just a reminder that when you're in a bar or restaurant and you're drinking alcohol, that you may become less inhibited and decrease the amount of social or physical distancing, which could potentially put you at increased risk.
And what about all those touch points, surfaces, condiments, silverware? Dr. Ellerin says get out your disinfectant wipes.
If your goal is to decrease transmission as much as possible, then that type of disinfecting practices may make sense for you.
Is it safer for people to be eating outside?
There is no question that it is safer to eat or drink outside rather than indoors. In fact, when you look at outbreaks around the world, and especially ones that have been analyzed in China and Japan, almost all of them have occurred indoors.
Studies out of China now showing that a woman who traveled from Wuhan to the city of Guangzhou near Hong Kong and ate at a restaurant transmitted COVID to 9 other people, some of whom were as many as 15 feet away. This week, a group of scientists also suggesting coronavirus may be infectious in the air, a concern the World Health Organization says it is examining.
We're also looking at the possible role of airborne transmission in other settings where you have particularly closed settings where you have poor ventilation.
It's important that indoor businesses, restaurants, bars, whatever, make sure they maximize their ventilation systems. That may significantly reduce the likelihood of transmission indoors.
When it comes to your risk, the CDC cautions that the more individuals interact with others and the longer that interaction, the higher the risk to spread COVID-19. The lowest risk when it comes to restaurants, drive-through, delivery, takeout, and curbside pickup. The next best thing, dining out where seating capacity is reduced to allow tables to be spaced at least 6 feet apart. The highest risk, indoor and outdoor dining where seating capacity is not reduced and tables are not spaced at least 6 feet apart. For his part, Wegman says his restaurants will do all they can to keep customers and staff safe as they navigate these uncertain times.
Whereas in the past, if you had a fever or a cough, you might bully an employee to come in because, hey, we're going to be short-staffed. Nowadays, you're saying, if you have a tickled throat, stay home because we're not bringing that in. That's our emphasis now, where food and drink and making money is sidetracked to getting people to feel safe and to stay safe.
If we remember the key components of COVID infection prevention, then I think we're going to be in good shape.
Ariel Reshef, ABC News, New York.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.